Transcatheter Aortic Valve Replacement, TAVR. Introduction. Is everyone a candidate for TAVR? Select yes or no. Correct. TAVR is an option for people who cannot have open heart surgery because of old age or other medical problems. In general, younger and healthier patients can have open heart surgery. You should tell your healthcare provider before the surgery about all of the medications and supplements you are taking. Select true or false. Correct. You may need to stop taking certain medications before the procedure. This can help prevent complications such as bleeding. Your aortic valve will be replaced by a valve made of animal tissue held inside a device called a stent. Select true or false. Correct. The new valve will stay permanently over the top of the old valve. The new valve will start working right away. TAVR is relatively safe. Select true or false. Correct. The TAVR procedure is relatively safe. There are possible risks and complications. These are not likely. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. You may feel weak or tired after the procedure, but it is important for you to get out of bed and walk. Select true or false. Correct. This helps prevent fluid buildup in the lungs. When you sit, prop your legs up to help prevent blood clots from forming. Thank you for using Explain.